Hi, this is Dr. Christine Wu. I'm the Deputy Health Officer for Solano County and the Chief of Communicable Diseases. I know that we all continue to be concerned in these uncertain times, especially when we listen to the news and see and hear all the alarming numbers coming out across the nation in New York and as well as in our own state. And we have heard your concerns and your questions about what the situation is like locally. Today, April 7th, 2020, there are 99 cases of COVID-19 in Solano County, including 2 deaths. And I know that this has been a concern that Solano County is also experiencing an rise in numbers, but I want to assure you that we are monitoring the situation very closely. This rise is in large part due to the increased testing that we have done through our commercial and hospital labs. A better indicator on our dashboard that you can see is actually the numbers of Solano County cases that require hospitalizations, and that can give us a better indication of whether or not there is an increase in community transmissions. However, we have not seen a dramatic rise in hospitalization rates for COVID-19 patients in our hospitals, so that's a good thing. You can also be reassured that there has been no major outbreaks in any of our cities. We now have a breakdown of cases by cities on our dashboard, and cities with larger populations expectedly will have higher numbers of cases. Another concern that has been raised by our community that is to better understand what we in public health have been doing to flatten the curve. The most important thing that we've done is to issue the shelter-at-home order. And Solano Public Health monitors all the guidances from the state as well as the federal government, the CDC, very closely. And we actually issued the shelter-at-home order based on the governor's recommendations and extended it based on the federal guidance. Right from the beginning in January, Public Health has been working nearly around the clock to better understand our local situation, because Solano County is different from any other county in California. We have urban areas, not as densely populated as San Francisco, but we have large cities as well as many not so densely populated areas and a lot of farmlands. And so we've been working to really understand and identify all the cases of COVID-19, investigate them, and determine whether or not quarantine or isolation is needed. We continue to evaluate every new case that is reported to us, and just to make sure that there is no outbreak in any of the high-risk vulnerable populations, for example, in the homeless, in our elderly population, those with chronic illnesses who live in long-term care facilities, or even any congregate setting, but also within our first responders and frontline staff, as well as essential service providers. And we've also been working on surge capacity planning in collaboration with our state to understand what the potential need for hospital beds would look like in our county. We've been working with our healthcare partners, our hospitals, to better prepare for an influx of patients, much like what you may have seen on the news about what's going on in New York. For example, we've been helping them ensure that they have adequate supplies of personal protective equipment and adequate staffing as part of the surge planning preparations. We've also continued to work on increasing our testing capacity here in Solano County. Because testing capacity is still limited, we still have to prioritize. Solano County has been working with the California Office of Emergency Services, or Cal-OES, to start a drive-through testing site for our first responders and symptomatic first responders and healthcare workers and essential workers. And this will begin on Wednesday, April 8th in Vallejo by appointment only. We believe that by providing testing for our first responders and essential staff, it allows them to get back to serving the community faster, which is beneficial for our community overall. Now on for the tip of the week. So Solano Public Health agrees with the CDC's most recent recommendation for the public to wear cloth facial coverings when they're out and about in public doing essential activities such as going to the grocery store or to the pharmacy. This does not preclude the need to adhere to this shelter-at-home orders, because maintaining that 6 feet distance from somebody and frequent hand washing is still the best way for you to slow the transmission of COVID-19. Additionally, I urge you not to confuse this recommendation with the masks that are needed for healthcare workers. The disposable surgical face masks, as well as the N95 respirators, should be reserved for healthcare workers still. If we have heard from you about how or where you can get the cloth facial coverings, the CDC has actually released a video with Dr. Jerome Adams, our Surgeon General, on a really easy no-sew technique for using a t-shirt and 2 rubber bands to make your own facial covering. And this is totally washable, and the link is available on the Solano County Public Health Facebook page. So the bottom line is that flattening the curve is a joint effort with everyone in our community. With our healthcare partners, with the state, our neighboring counties, as well as each and every one of you. By you staying home and taking the shelter-at-home order seriously, especially this weekend when it's Easter weekend, we understand that you are making a big sacrifice, but you are saving lives. Whether you're working from home, out working to help keep us safe and fed, or staying at home, we're here for you. This week happens to be National Public Health Week, and that really reminds us that it's so important for us to protect the health of our community. To learn more about the local, state, and federal guidances and resources on COVID-19, you can go to solanocounty.com/COVID-19, covid19.ca.gov, or coronavirus.gov, and we will have those links for you in this on the bottom of this video. Thank you. Stay safe.